Well, it is related to the variants that we've seen circulating over the last year. In fact, JN1, which really pushed through a year ago now, it was the one that actually produced a whole lot of subvariants. It caused the summer wave and went into the winter wave. Our winter wave was really dominated by some of the fluke subvariants, and we also heard about the flirt variants. And this new subvariant they're talking about, XEC, is actually a recombination of one of the fluke and one of the flirt variants. So it's all part of the JN1 family. But again, it looks like it's got a growth advantage by having this particular mix of mutations. It in the Northern Hemisphere, where they're really watching what's happening as they go into their winter, they are seeing a push up in the case numbers, and it's the XEC variant that is the one that seems to have a growth advantage. So it looks like it's the variant that's come through off the back of the last wave. It's been around since about May this year, but now as natural immunity wanes, as that last wave gets further in the rear vision mirror, this is now the opportunity for this variant that looks slightly different to have that advantage, and will likely drive our late spring summer wave here as well.
So do you think summer is when we might see a peak in infections of this new variant here in Australia?
Well, we've moved into this pattern of around 6 months break between the peaks, and it, you know, if you look at the data coming out, whether it's the wastewater sewage or the testing or what we're seeing in pharmaceutical prescriptions and so on, in some places it looks like we might be starting to come out of the dip that we've had post the last wave. So I suspect by the end of this month we'll know whether we're going to see the same rise in cases here that we saw last year around this time. But it looks likely, given what we've seen in the Northern Hemisphere, this XEC variant has gone from being quite a low percentage, particularly in North and Eastern Europe. It's taken off. In the UK, they're saying it might make up more than 50% of cases in the next couple of weeks. And if the same happens here, it's probably likely to coincide with a rise in infections too, as more people progressively become more susceptible to an infection because their immunity from either a last vaccine or from having an infection, even in the winter wave, does start to wane after a few months.
And are the symptoms different, worse than any other strain we've seen here in Australia?
Well, so far, no, thank goodness. We're not seeing more people hospitalised for that background infection rate. So as the number of infections goes up, though, of course, some people will still get quite unwell and those numbers will go up. But it doesn't look like this variant is causing more severe illness at this stage. But just a couple of weeks ago, the World Health Organization declared this a variant under monitoring, so it's on the watch list, because if it has this growth advantage, you really want to be sure that it's not accompanied by unusual symptoms or more severe illness as well. So they're watching closely, but so far it looks like it has the growth advantage, and it just means, which is really frustrating, but that we have yet another wave to go through. But hopefully it won't look too different, and in some ways, hopefully won't be as bad. If we had a winter wave driven by KP3, one of the ancestral variants to this particular new one, then hopefully that will give us a bit more of a protective cover that at least should help, if not protect from infection, but at least reduce the severe illness risk.
How prevalent is COVID-19 now in Australia, say compared with a year ago, this time last year, and also compared to other viruses such as flu and RSV?
Well, flu and RSV are coming off at the moment, and COVID did peak quite early in about June, and we've been trailing off that. So we're probably at our lowest levels at the moment, which is reassuring, and it means it doesn't go away. There's always a background risk in the population. There's still people who bring it back from overseas and it's still being shared locally. But we're probably at our lowest levels we've been for a while. It's hard to tell. We can base it on hospitalisations, but it looks like progressively fewer people have been ending up in hospital who have been vaccinated as we build immunity, and the people who are vulnerable take advantage of up to 6 monthly booster doses if they're eligible over 75 or if they have, they're particularly immunocompromised. But other people also, it pays to look at your vaccination status. If you have avoided infection over the last year, then now's the time to think about whether you've had your 2024 vaccine. If you're an adult, particularly over 65, it's recommended to have at least one. Then now's the time to look at it, because it takes a couple of weeks to get the full benefit from that. So I think at the end of the day, we're probably seeing each wave, we've seen fewer people in hospital and thankfully fewer deaths, but it will probably level out at some point so that we still have that risk each time we have a wave. And the fact that we have 2 waves a year, unlike flu, where we still mainly have a winter wave, though that can occur all year round, it's really trying to manage the waves so that we keep infection under control, so those people at risk of severe illness or of long COVID, even though that might not be as common with these new variants, avoiding infection is still the best thing to do. And that keeps the whole population a bit safer if there's less virus out there, if we pay attention to symptoms and stay at home if we're unwell, and we can do that.
Professor Catherine Bennett, thank you so much for your detailed response. We've learnt so much. Really appreciate your time.
Thanks, Yvonne.